May is Mental Health Awareness Month, and one local organization is making sure Louisville knows no one has to face mental health challenges alone. NAMI Louisville is bringing the community together all month long with events, education, and support. Joining us today is Nancy Brooks. Thanks for joining us.
Hi, thanks for having us.
You know, May, there's like so many different awareness things happening in the month of May. Of course, we're just getting off of Derby. I mean, how stressful that was, you know, getting everything together. Mother's Day was yesterday, so a good time to celebrate moms, of course. But we have to take time for ourselves, most importantly. So that's how we can pour into other people. So for those who aren't aware of NAMI, what exactly do you guys do?
Well, we are a local nonprofit that has a national alliance to support us. So one of the beauties of that is that they design some really incredible programs that we're able to bring to our local community. But we're independent in the sense that we are funding ourselves and running whatever programs we see fit for the community. Our kind of largest focus areas are support groups for individuals with lived mental health experience, education classes, and support groups for family members of those same individuals because it is a full family illness and we want to wrap ourselves around the family as well. And some youth programming that we've brought on through the past several years that is really starting to blossom into some really important work.
I know, you have so many things. And again, I love how you just really want to wrap your arms around the family because that's where everything truly starts right there. And this year's message is Louisville, you are not alone. So why was that the theme this year? And of course, why was it so important to kind of push that through the month of May?
I love that you asked it that way because You Are Not Alone is really a theme we've had for a long time at NAMI Nationals level, but we are pushing that through now because we recognize the struggles of families who are looking for support and don't know where to go. And they start, you know, Googling things or trying to ask the doctor for a suggestion, whatever it might be. And ultimately, they're still alone. They still feel isolated. They don't have a network around them. That's where things change. When they come to NAMI Louisville, not only do they meet peers that have similar relationships, because that's how we design all of our groups. So if you're a parent, for example, of a young person struggling with mental health, you will take the education class for parents, or you'll go to the support group for parents. So very, very much peers in relationship to what you're dealing with. We also want people to know that we're here. There are so many organizations out there doing specific work for mental health. But if you don't have us helping you navigate that, you're missing a really important key part of the process. We're going to actually make some calls before we even get back with you and tell you this is a great resource for you. And so we've already done some of the work, and it's all free. We don't charge anyone any fees for our services. Doesn't mean we don't need money to do those services, but we don't charge the member who comes and takes a class.
Well, and that's great, you know, breaking down those barriers because, you know, there's probably already enough going on in the family. Everything's so expensive nowadays. So to get that mental health support, to have it completely free, that's amazing. And so you are lighting up the Big Four Bridge blue this month, you know, really, again, getting that awareness. So that is such a powerful visual. And so what does that moment really present you and for your organization?
Well, and you're right, the visual is what we were going for. We want this to be our most visible and kind of meaningful event. It is tomorrow night, and we will climb to the top of the Kentucky side of the bridge together. So anyone is welcome, it's free, and you do not have to register to attend. We'll then have a few speeches. We're going to be passing out artificial yellow roses that have tags on them with quotes about mental health, and then you can either write your name or we'll have another name of someone who we know has struggled with mental health. So as we walk the bridge, we'll be carrying our yellow roses. We'll go to Indiana, we'll walk back, and that's when the bridge should be lit up. And so it should be incredibly meaningful and hopefully just a great opportunity for us to show the impact by having a large audience. So again, I'm grateful for you letting us be here today.
Well, no, I'm grateful for you because mental health, I feel like, has been on the forefront of a lot of people's minds and part of that conversation, but still, it's hard to talk about.
Yeah.
You know, a lot of people don't want to admit that they're having mental health struggles. So why are events like this just so important to kind of rally the community together?
Exactly, exactly. And you really touched on something that I think is important. There is still stigma associated with mental health. And because of that, some folks will ignore the signs and symptoms.
Right.
But what I like to remind people is that all of us have had what I would call a psychological injury. I don't know, maybe you were teased about some physical characteristic
Yep.
as a child, or as an adult, you had some experience that maybe still embarrasses you, or you wish that you could have edited out of your memory bank. So you push it back, and it's back there. It's
Yep.
just waiting. And as it's pushed back and waiting, all it needs is a reason to come out. That could be a car accident, a divorce, a death in the family. It doesn't matter what the trigger is. It could be a billboard on the side of the road.
Yeah.
But once it's brought back up, you have to deal with it.
Yep.
Folks, we can't just keep pushing things back forever. Eventually, like, that splinter you get in your hand, it's going to become infected and need some support.
Absolutely.
And again, we're there to help folks when that day shows up.
And before that day comes up, you definitely want to get in touch beforehand. So how can people learn more about all of your services?
Yes, well, go to NAMI.org is probably the best way, NAMILouisville.org. I'm sorry, I said that wrong.
Yeah.
If you want to reach out to us, there's also a connect button there. You can also call the phone number at the office. Now, we don't answer the phone numbers like a crisis line. We want you to know that. It'd be better to call 988 if you were in a crisis, but definitely reach out. Let us know that your situation is X, Y, and Z, and one of us will reach back out to you and get you connected with some resources. And Elle, you picked a very important point.
Yeah.
Don't wait till the last minute. What we do know is that when folks end up in a hospital setting because of a mental health crisis, it doesn't automatically make it better. You've created a new level of trauma for yourself or your loved one. And now you're also limited to how long you can stay because of your insurance. So you may only get 3 days in the hospital, for example, with the new trauma, the old trauma, all the stress.
It's just layered on layers on layers.
Yes, and so we want you to come before that situation arises. Absolutely.
All right,
absolutely.
Nancy, perfect timing on this. Thank you so much for stopping by today.
Thank you. Thank you.
All right, to learn more, just head over to NAMILouisville.org.